Welcome back to Breastfeeding Nurtured All You Need to Know. Today, in session 10, Breastfeeding, Maternal Nourishment, Health and Fertility, we will discuss suitable dietary recommendations for breastfeeding mothers, ways to support ill mothers in continuing breastfeeding, and how breastfeeding aids in family planning. Before we dive into the first slide, don't forget to subscribe to my channel by simply scanning the QR code. Stay informed with the latest breastfeeding best practices. Don't miss out. Join us today. Let's get started with our first slide. Supporting a breastfeeding mother requires considering her health, nutrition, illness management, and the link between breastfeeding and family planning to ensure both her well-being and her babies. By the end of this session, we will be able to recognize the importance of maternal health and nutrition in supporting breastfeeding, identify strategies to assist breastfeeding mothers during illness and understanding the impact of medications, explain the role of breastfeeding in family planning and provide relevant guidance to mothers, equip mothers with accurate and practical information to support both her health and their baby's well-being. WHO and UNICEF emphasize the first 1000 days of life, including pregnancy, to the child's second birthday as a critical window for nutritional interventions. This critical period is divided into three phases. The first phase is the pregnancy, which begins at conception, marking the start of nutrition in the womb. Therefore, a mother's diet during pregnancy becomes crucial, directly influencing fetal growth, brain development, and overall health. The next phase begins after birth and continues until 6 months, during which the baby receives complete nutrition through exclusive breastfeeding, providing essential nutrients, immune protection, and supporting optimal growth and development. The third phase of late infancy and early childhood, from 6 months to 2 years, is the stage when complementary feeding begins with age appropriate solid foods, while continued breastfeeding up to at least 2 years supports optimal growth, development, and immunity. These 1000 days, including 270 days in the womb and 730 days after birth, form a critical window for growth and development, shaping a child's lifelong health, intelligence, and well being. This period is marked by rapid physical growth and accelerated brain development, making proper nutrition and care essential. What parents do during these formative years, including providing optimal nutrition, has a lasting impact on their child's future health and potential. Before discussing maternal nutrition, let's briefly review pregnancy readiness for a healthy start. The decision to have a baby should be the mother's personal choice. She should make an independent decision and avoid peer or family pressure. She should wait until ready. Avoiding pregnancy before 18 promotes both her well-being and the baby's health. She should maintain a healthy gap between pregnancies. A minimum gap of 2 years allows better recovery for the mother and ensures proper nourishment for both children. Mother should plan her resources considering the financial, emotional, and logistic aspects of welcoming a baby. Mother should be prepared holistically with her spouse, focusing on physical, mental, emotional, and financial readiness before pregnancy. Mother should prioritize a comprehensive health checkup to identify and address any potential concerns in advance. Mother should adopt a healthy lifestyle with a balanced diet, regular exercise, and a positive habits for a smooth pregnancy journey. She needs to keep her hemoglobin above 12 gram per deciliter and consult a healthcare professional if it drops. She should use contraception wisely. Stop birth control pills at least 6 months before trying to conceive. If mother is not ready for pregnancy, she should consult a healthcare provider for the best contraception method and use it consistently until she decides to start a family. During pregnancy, a woman's diet is vital for both her own health and the proper development of the fetus, which relies entirely on her for nutrition. We will focus on the primary topic of nutrition during pregnancy in the next slide. First, let us briefly touch upon other important aspects that contribute to the optimal development of the fetus without going into the details. Stay active by engaging in regular physical activity like walking or yoga to maintain a healthy weight before and during pregnancy. Being underweight or overweight can affect conception and pregnancy outcomes. Household chores or job related activities do not replace the need for dedicated exercise. Folic acid intake is essential for preventing spinal and brain birth defects in the baby. Taking 400 micrograms daily, starting from the time you plan for pregnancy until at least 3 months into pregnancy, ensures proper fetal development. If this dosage is unavailable, a 5 milligram tablet can be taken along with folic acid rich diet. Avoid harmful chemicals by minimizing exposure to pesticides, toxic cleaning agents, and lead-based products. Rinse fruits and vegetables thoroughly. Avoid using mosquito coils in closed rooms and store food in glass or stainless steel containers instead of plastics. If working in an environment with toxic chemicals, take necessary precautions such as changing clothes and showering after work. Prevent infections by washing hands frequently, maintaining hygiene after using the toilet, and avoiding close contact with sick individuals. Refrain from sharing food, drinks, and utensils with those who are unwell. Vaccinations like rubella and hepatitis B should be taken before conception to protect the baby from serious infections. Consult a doctor about necessary immunizations and avoid pregnancy for a month after receiving certain vaccines. Medical consultation with a healthcare provider ensures early detection and management of any pre-existing health conditions like hypertension, diabetes, or epilepsy. Routine tests for blood pressure, blood sugar, and infections such as HIV and syphilis help ensure a healthier pregnancy. Oral health should not be neglected as gum disease can affect pregnancy. Regular dental checkups along with brushing twice a day for at least 2 minutes help maintain good oral hygiene. Avoid tobacco, alcohol, and drugs as they can lead to complications like premature birth, low birth weight, and developmental issues. Exposure to smoking and alcohol increases the risk of miscarriage and sudden infant death syndrome. Emotional well-being is crucial as stress can impact fetal development. A supportive family environment, reducing anxiety, and seeking help when needed contribute to the healthier pregnancy. If facing domestic violence, reach out to trusted individuals, community health workers, or women's helpline services for support. Now let's focus on the key topic, nutrition during pregnancy. Getting back to our core discussion on nutrition, starting with pregnancy and then moving on to lactation. Proper nutrition is essential during pregnancy as the mother's diet directly impacts her own health as well as the growth and development of her baby. On an average, a pregnant woman gains around 10 to 12 kg, which includes the baby's weight and requires extra calories and additional proteins daily to support fetal development and prevent depletion of her own body reserves. If her diet is inadequate, it can lead to poor fetal growth and increase the risk of low birth weight and malnutrition. Key dietary recommendations for the pregnant mother includes the following: balanced and frequent meals. Pregnant women should opt for 5 to 6 small meals spread throughout the day instead of 3 large meals. A well-balanced diet that combines cereals, pulses, and vegetables in a single meal is recommended to ensure all essential nutrients are adequately met. For example, a combination of rice for carbohydrate, pulses for proteins, and fiber, green leafy vegetables for minerals and vitamins, and a small amount of oil for extra energy and enhanced taste forms a good nutrient meal. Cereals and whole grains form an important part of nutrition, including rice, wheat, ragi, bajra, and jowar, which can be consumed in various forms such as chapati or bread, idli, dosa, or upma. Refined flour should be avoided, which lack essential nutrients. Protein sources for non-vegetarians include fish, eggs, and cooked meat, whereas for vegetarians, 2 servings daily of legumes, beans, and lentils or dal ensure adequate protein intake. Seasonal fruits and vegetables should be consumed to meet vitamin and mineral requirements. Daily intake should include 2 servings of green leafy vegetables, which are rich in iron to prevent anemia. 1 serving of starchy vegetables like potatoes, carrots, and beets. 1 serving of other vegetables such as ladyfinger, brinjal, tomatoes, and beans. Remember that colorful fruits and vegetables are more nutrient rich. Dairy products are good source of calcium. 2 glasses of milk or 2 servings of curd or 60 grams of cheese should be consumed daily for adequate calcium intake. For fats, choose healthy oils such as mustard oil, rice bran oil, or groundnut oil to ensure sufficient omega-3 and omega-6 fatty acids. Flax seeds can also be included, which are rich source of omega-3 fatty acids. Iodized salt should be used to support the baby's brain development and prevent iodine deficiency disorders. Iron and folic acid supplementation are an important part of nutrition during pregnancy. Pregnant women should take iron and folic acid supplements regularly to prevent anemia and ensure proper fetal development. Iron-rich foods include green leafy vegetables, legumes, and fortified cereals. For adequate hydration, a pregnant mother should drink at least 10 to 12 glasses of water daily, which will maintain proper digestion, circulation, and amniotic fluid levels. By following these dietary recommendations, a pregnant woman can support her own health and ensure optimal growth and development of her baby. After understanding the importance of nutrition during pregnancy, let's now focus on maternal nutrition during lactation. This is crucial period when a mother's diet not only supports her own recovery but also provides essential nutrients for her baby's growth and development through breast milk. This diagram illustrates how the fat accumulated during pregnancy serves as an energy reserve for breastfeeding. In well-nourished women, this fat is gradually utilized in the early months of lactation to produce breast milk. In contrast, women with inadequate nutrition have smaller fat stores. Producing breast milk requires approximately 700 calories per day. As shown in the diagram, around 200 calories come from the fat reserves, while the remaining 500 calories must be obtained from the mother's daily diet during breastfeeding. Let's have a look at the dietary content of the lactating mother in the next slide. During lactation, a mother needs additional calories and extra protein each day to support milk production and prevent the depletion of her body tissues. To fulfill these nutritional needs, it is essential for mothers to consume a diverse range of nutrient-rich food. Balanced and frequent meals refer to the practice where lactating mothers who may struggle with large meals due to fatigue or time constraints are encouraged to have 5 to 6 small frequent meals throughout the day, including healthy snacks. Mixed dishes like nutritious khichdi made with rice, pulses, and vegetables provide a well-balanced blend of energy, protein, fiber, vitamins, and minerals. Essential food groups emphasize the importance of incorporating a variety of nutrient-rich foods into a lactating mother's diet to support milk production and overall health. Cereals and pulses provide sustained energy and protein through foods like rice, wheat, ragi, bajra, and pulses such as moong dal, masoor dal, and rajma. Fruits and vegetables supply essential vitamins, minerals, and fiber. Consuming seasonal fruits, at least 2 servings of green leafy vegetables, daily aids digestion and improves milk quality. Dairy products like 2 glasses of milk, 2 servings of curd or 60 grams of cheese fulfill daily calcium and protein needs. Meat, fish and eggs are excellent sources of high quality protein and iron for non-vegetarians, while vegetarians can rely on legumes, beans, dals and nuts for similar nutrients. Healthy fats are essential for providing omega-3 and omega-6 fatty acids using mustard oil, rice bran oil or a combination of oils along with teaspoon of pure ghee or oil in meals offer extra energy. Importance of micronutrients highlights the critical role of essential vitamins and minerals in maintaining the health of lactating mothers and supporting optimal growth in babies. Iron and calcium are vital as breastfeeding mothers lose calcium during lactation. Consuming dairy products helps maintain adequate calcium levels, while iron-rich foods like spinach and legumes prevent anemia. Iodine is essential for the baby's brain development. Using iodized salt ensures sufficient iodine intake. Folic acid and vitamins are crucial for overall health. A well-balanced diet rich in fruits and vegetables provides adequate folic acid, vitamins, and antioxidants. Hydration is essential for lactating mothers to maintain adequate milk production and overall health. Drinking at least 10 to 12 glasses of water per day is recommended to ensure proper hydration. Other healthy fluids such as buttermilk, coconut water, lemon water, and soups also help maintain hydration levels. It is advisable to avoid excessive caffeine and sugary drinks to prevent dehydration and other health issues. We have seen that period of pregnancy and lactation is a time when a woman requires more food than a normal woman because she has not only to nourish herself but also the growing fetus in her womb and after delivery for her growing infant. Therefore, in comparison to a balanced diet for adult women, pregnant and lactating mother need approximately 600 extra calories per day. When this additional energy comes from a variety of foods, it naturally ensures sufficient intake of proteins, vitamins, and minerals. A table comparing nutritional requirements shows that a pregnant woman requires an additional 270 grams of cereals and 60 grams of pulses per day over and above the intake of a normal healthy adult woman. In comparison, a lactating mother needs even more, an extra 30 grams of cereals and 60 grams of pulses per day on top of the 270 grams of cereals and 60 grams of pulses required by a pregnant woman. Thus, the nutritional needs for cereals and pulses are higher during lactation than in pregnancy. However, the additional requirement for fruits, milks, and sugar remains similar for both pregnant and lactating mothers, with slightly higher needs for fats and oils during lactation. This overhead highlights how maternal malnutrition can affect breast milk production. We have seen that during pregnancy, it is essential for the mother to consume extra food to meet the increased caloric needs required for breastfeeding. As indicated in the graph, severe malnutrition can lead to a noticeable reduction in breast milk production. However, with moderate malnutrition, breast milk production remains sufficient and of good quality. Even in cases of severe malnutrition, a mother may still produce a significant amount of breast milk if her baby breastfeeds frequently, though it may not always be sufficient. While the milk may contain lower level of fats and certain vitamins compared to that of a well-nourished mother, it continues to provide valuable nutrition. Let's discuss about supporting breastfeeding mothers facing nutritional challenges. Practical dietary support to mothers in low-income settings should be encouraged. Mothers should be guided to increase their intake by having an extra portion of their usual diet rather than depending on special or expensive foods. Maternal supplementation should be provided to improve her nutrition and enrich her breast milk. To sustain milk supply, frequent breastfeeding should be encouraged to support continuous milk production. Even in challenging nutritional conditions, breast milk remains the best source of nourishment for the baby. Mothers often stop breastfeeding when ill, fearing transmission or following advice to discontinue. Hospitalization and separation can also disrupt feeding. In most cases, breastfeeding is safe and should continue as it rarely increases the baby's risk of illness. Instead, breast milk provides protective antibodies that strengthen the baby's immunity. We will discuss breastfeeding during specific maternal infections like hepatitis, tuberculosis, HIV, chickenpox, and COVID-19, etc. in one of the sessions later. However, here's a brief general overview. In order to support a sick mother to continue breastfeeding, always ask every sick woman if she has a breastfeeding baby and encourage her to continue. If hospitalized, the baby should be admitted alongside the mother whenever possible. For mothers with fever, ensure they stay well hydrated. If the mother is too unwell or unwilling to breastfeed, assist her in expressing breast milk so that baby can be fed by cup. In cases of severe illness, expressing breast milk remains an option for continued feeding. For mothers experiencing mental illness, arrange for a caregiver who can support both the mother and baby. Once the mother recovers, guide her in increasing her milk supply or relactating if needed. Since breastfeeding provides vital immune protection, stopping is rarely necessary in common illnesses. With the right support, most mothers can continue providing the best nutrition for the baby even when unwell. Now, even after we have supported a sick mother to continue breastfeeding, some difficulties may still come up. Let's look at how these problems often start and how we can help overcome them. Many mothers assume that illness means they must stop feeding. Whenever a woman seeks treatment for any illness, it is important to take a moment to ask about her breastfeeding status. Questions like how old is your youngest child and is the child still being breastfed help identify whether ongoing breastfeeding support is needed or not. These simple questions open the door to providing guidance and reassurance, especially if the mother is unsure about continuing to breastfeed while she is unwell. Reassurance should be given and explained that in most situations, breastfeeding can be safely continued even during illnesses. Infections are more likely to be transmitted through respiratory droplets or contaminated hands rather than through breast milk. Antibodies present in the mother's milk are usually produced, offering protection to the baby. If breastfeeding causes significant discomfort, milk should be expressed to maintain supply and breastfeeding be resumed once the mother feels better. Now, some mothers often complain that her milk stopped during illness. It's not the illness itself, but the baby's reduced suckling that leads to less milk. A high fever, dehydration, or exhaustion may reduce milk temporarily. To keep her supply going, encourage her to breastfeed frequently even during illness. Drink enough fluids to stay hydrated. Express milk if the baby isn't feeding well. Resume direct breastfeeding as soon as possible. When illness involves the breast, mothers often discontinue breastfeeding due to pain or swelling in the breast, but stopping feeds can make the problem worse. In such cases, mothers should be supported to keep feeding, especially from the unaffected breast, and continue expressing from the affected side if feeding is too painful. In some cases, she can continue feeding safely from the affected side while also receiving treatment. We have already discussed this in session 5 on managing breast conditions. Sometimes health workers advise mothers to stop breastfeeding when they are on medication, fearing that the drug might pass into the breast milk and harm the baby. However, in most cases, only very small amounts of medicines enter the milk and very few actually cause harm to the infant. In fact, stopping breastfeeding can often be more harmful than continuing it while taking the medication. While most medicines are generally safe during breastfeeding, certain situations may call for certain extra caution and careful evaluation. Mothers on chemotherapy or radioactive treatment should usually stop breastfeeding temporarily. These medications are rarely used and are strong enough to pose a real risk. Some psychiatric and anticonvulsant medicines like barbiturates or diazepam may make the baby unusually sleepy, especially if the baby is less than a month old. Phenytoin can cause methemoglobinemia in infants. In many cases, switching to a safer alternative is possible. Most antibiotics are safe. However, certain antibiotics like chloramphenicol, tetracycline, and metronidazole are best avoided if alternatives are available. If such antibiotics are essential, breastfeeding can usually continue while the baby is monitored. Sulfonamides like cotrimoxazole, Fansidar or Dapsone should be avoided in babies with jaundice. If these drugs must be used, consider temporary alternative feeding if the baby shows signs of worsening jaundice. Avoid drugs that may reduce breast milk production such as estrogen containing contraceptives or thiazide diuretics like chlorothiazide. Use alternatives when possible. Most medications commonly prescribed to the breastfeeding mothers are safe when taken in usual doses. In rare cases where a medicine is not suitable, alternative drugs or feeding plans can often be arranged without completely stopping breastfeeding. In clinical practice, we often come across questions about whether a particular medicine is safe for a breastfeeding mother or not. Instead of stopping breastfeeding out of caution, it's best to consult reliable sources. Organizations like WHO, UNICEF, and national health departments regularly update their recommendations. There are also user-friendly online databases like LactMed, which give detailed research-backed information on drug safety during lactation. These tools help us make informed decisions and support mothers confidently. Before prescribing any medicine to a breastfeeding mother, it's crucial to assess whether the drug is essential. If needed, we should select the safest possible alternative that poses minimal risk to the breastfeeding infant. Choose drugs with a low milk to plasma ratio, short half-life, high molecular weight, strong protein binding in maternal blood, low fat solubility, and that are ionized in plasma. Drugs with these properties are less likely to pass into the breast milk in significant amounts and are thus considered safe for the infant. It is to be noted that drugs that poorly cross the blood-brain barrier also tend to reach lower concentrations in milk. Prefer local or topical treatment over oral drugs or injections as local treatment reduce systemic absorption and milk transfer. Take the medicine just after breastfeeding or before baby's longest sleep to reduce the amount of drug the baby may be exposed to. Combination medicines may carry additional risk. A single drug with a known safety profile is preferable during breastfeeding. So prefer simpler medications or choose single ingredient drugs. For example, use plain paracetamol, not mixed with caffeine or aspirin. When a potentially risky drug is necessary, it's vital to closely observe the infant for any side effects like drowsiness, feeding refusal, jaundice, irritability. Serum monitoring may be needed in rare cases. If breastfeeding has to be paused temporarily, mothers should be advised to express breast milk. This helps maintain lactation and allows safe feeding later. Expert consultation can prevent unnecessary cessation of breastfeeding. If no safer drug is available and side effects appear, alternative feeding may be needed briefly. Breastfeeding plays an important role in natural birth spacing by delaying ovulation. Understanding when and how breastfeeding provides this protection helps guide mothers in planning their families safely and effectively. However, this protection is time sensitive and depends on specific conditions. This method offers protection only if the mother hasn't resumed her periods after childbirth. It is most effective in the first 6 months and when the baby is fully breastfed day and night and no other food or liquids are given. Introducing other feeds before 6 months lowers the contraceptive effect of breastfeeding. After 6 months, as complementary foods become necessary, breastfeeding offers only partial protection. Continued frequent breastfeeding may still help delay pregnancy if other contraceptive options cannot be used. Hence, it is useful to some extent even after 6 months. For most women, fertility resumes with the return of their periods, making it a common sign of being able to conceive again. However, some women may ovulate and become pregnant even before their first postpartum period. This is more likely once the baby is older than 6 months, which increases the chance of pregnancy even without menstruation. Kindly note that if a mother's periods have not returned, her baby is under 6 months and is fully and frequently breastfed, the chances of pregnancy is less than 2%. This natural method of family planning is also known as lactation amenorrhea method or LAM. It's important to talk to breastfeeding mothers about family planning. If a mother becomes pregnant again too soon, she may stop breastfeeding early. Proper spacing helps her continue breastfeeding longer. Not all contraceptive methods are suitable during breastfeeding. It's essential that the chosen method does not interfere with breast milk production. Let's explore which contraceptive methods are safe and suitable during breastfeeding. The preferred option is the non-hormonal method which do not affect lactation like the intrauterine device, condoms, diaphragms and the spermicides. They also add to the natural protection breastfeeding offers, especially after the baby is 6 months old. Progestogen only hormonal methods are generally safe and considered a suitable alternative during breastfeeding, as they typically do not affect milk supply. These include the progestogen only pill called POP, Depo, Provera injections, and Norplant implants. Combined hormonal methods are the least preferred and should be used cautiously. These contraceptives contain both estrogen and progestogen, like the combined pill or monthly injections, which can reduce milk supply. Breastfeeding mothers should avoid combined oral contraceptives during the first 6 weeks after birth. Estrogen in these pills can reduce milk supply in the early days and if started before 3 weeks postpartum may raise the risk of blood clots. However, if no other method is available, using them is better than risking an unplanned pregnancy. Mothers should be encouraged to breastfeed frequently to help maintain their milk supply. Among contraceptive options during breastfeeding, non-hormonal methods remain the safest and most preferred, followed by progestogen-only methods as a safe alternative. Combined hormonal methods are the least preferred and should be avoided whenever possible. That concludes session 10 on breastfeeding, maternal nourishment, health, and fertility, where we discussed nutrition for breastfeeding mothers, supporting ill mothers to continue breastfeeding, and breastfeeding's role in family planning. In the upcoming session 11, titled Breastfeeding Strategies for Employed Mothers, we will discuss counseling on continued breastfeeding, maximizing breast milk intake for babies during the mother's absence, and guiding caregivers on cup feeding. We encourage you to continue sharing your thoughts, questions, and suggestions for future topics to help us better support your learning journey. Feel free to reach out via email at rajinder_gulati@hotmail.com. Your feedback is invaluable as we strive to create informative, helpful content. Thank you for joining us and we look forward to continuing this journey together. Have a wonderful day.